My name is Nicole Walters. I'm in Section 4 and will be demonstrating IV piggyback. First, I am checking my doctor's orders. My doctor has ordered vancomycin, 500 milligrams, which is a safe dose. My vancomycin is an antibiotic that binds to bacterial cell wall. It's bactericidal. It's used for severe systemic infections such as MRSA. It's used in patients allergic to penicillin. The recommended dose is 500 milligrams every 6 hours. The side effects are red man syndrome, ototoxicity, nephrotoxicity. Contraindications are allergies to the drug if the patient is taking aspirin, aminoglycosides, loop diuretics. Nursing implications are the whisper test for cranial nerve number 8. I would check renal functions and culture and sensitivity before the first dose. This is my drug card. It's to be infused over 60 minutes. The drop factor I have calculated is I have a 50 ml bag, and Vanco is to be run over 60 minutes, and my tubing has a drop factor of 10, so it will be infusing at 8 drops a minute. Now, I'm doing hand hygiene. I'm cleaning off my medicine bottle. Now, I'm checking my medication against my MAR. I have available 500 milligrams per milliliter, and the doctor has ordered 500 milligrams, which means I'll administer 1 ml of vancomycin into my 50 milliliter bag of saline. I will inject this into my bag. This will go in the sharps. I will gently mix my medication. I will be labeling this bag with my initials, the date, the time, the dose, the route, and the frequency. Now I will attach my tubing. I will be very careful to maintain sterility. I will prime my tubing, clamp it off. I will introduce myself to my patient. I will check their name, band, 2 identifiers, ask if they have any allergies. I will make sure their site is intact. I will lower their primary. I will now make sure I have clamped off my primary. I have stopped it from running. I will now do my hand hygiene once more, apply gloves. I will cleanse my port. I will cleanse my port over here. I will attach it. I would have primed my tubing. Now I'm setting my drop factor, which is 8. This infuses, I will stay with the patient to make sure they have had no allergies, check the 4 Ps. I will come back in 15 minutes just to be sure they have had no kind of reaction. After 60 minutes, my bag should have infused. I will check that. I will turn off I would have labeled my tubing with my initials, the date and the time. I will now unclamp. I would have done hand hygiene, put gloves on. I will now unclamp my secondary, and I will get I could get rid of my secondary here. Now I'm reattaching, restarting my primary, making sure it's unclamped, setting my drop factor, making sure everything's running. I will double check for any allergies. I will check my 4 Ps. I will document the time, date, dose, drug, route, site condition,